We're going to do the subacromial bursa. You can do this in the seated or the lateral decubitus position. I prefer the lateral decubitus position whenever possible, primarily because the patient's already laying flat. If they're going to go vasovagal, they're already in a comfortable and safe position to take a little bit of a nap while we go see somebody else and our support team helps them. Kidding. But that's why I prefer this lateral decubitus position whenever possible. If we can construct the procedures so that we're in plane, to me, that's always preferable because we get a better look at the tip of the needle most of the time. So this is a video from one of our studies where we were injecting bone marrow concentrate for patients that had partial thickness rotator cuff tears. Now, the video on the right is just showing one way to do that. I'm going to give you a better example in a minute. But so right now, let's start this video. You can see the needle coming in here. Here's a subacromial injection where we want to get deep to the deltoid. And if we're doing this in the right spot, you'll see the fluid track all the way medial and lateral. We want to leave the tip of this needle just below this white line. Really important distinction. That white line is the inferior border of the deltoid. So we're not talking a large distance or a large space here at all. If we can just see the tip of the needle, if we can get it just below that white line as we inject, that fluid ought to track along the superior border. I'm going to give you a really good example of that in a minute. So I'm going to go past this. Here's another example. Again, the needle gets just below. This is a short axis view of the rotator cuff tendon. But as we put in the needle and back off a little bit, as we start to inject, we should see the hydrodissection, and we should see the fluid going into that subacromial space.